topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Tennessee. Welcome to another Ask the Expert show, where for the last 16 years we have brought you the top experts in the field of legal, health, financial, and home improvement. We have got an incredible show for you today. Hey, this is October, and October is Medicare time. But before we get started with the show, I got to tell you, there's a lot of agents out there. I learned several years ago how important it is to have a good agent and an agent that you can yoke with. And we were so lucky, because Tennessee is one of our biggest markets. We were so lucky to find Randy Hall of Independent Medicare Brokers, Mr. Nice Guy Medicare. We were so lucky to find him. He's really a good guy. And listen, if you're going to be purchasing Medicare for the first time, you want somebody, and I learned the hard way, believe me, you want somebody who is easy to get along with, who really cares and knows his business. Let me welcome everybody to Randy Hall. Good afternoon, Randy.
Good afternoon, Steve-O and audience from Franklin, Tennessee. How are you?
Yes. And don't be getting a big head after that opening monologue.
You make it hard. You give me
It's
the big
really
head.
true. Randy, I could tell from the first time that we started talking, I really, really enjoyed our conversation. But the most important thing is it's really easy to recommend you as an agent of Medicare, because I told you before on the show, I learned the hard way. You can't just sign up with anybody. You've got to have somebody who really cares, who really knows the business. And Randy, you are it. Tell people about Mr. Nice Guy Medicare.
Well, one thing that we specialize in is education. So when we get with a client or a potential client, we try to find out what your situation is. And based on that, we make recommendations. I'm a broker. So when you're a broker, you can sell almost anything available, either whether it's a Medicare supplement or a Medicare Advantage plan. So based on your budget, your preferences, whether you care about a network or not, your risk tolerance, we look at everything. We listen to you. And then based on what we come up with you, we try to match make you with the best situation and plan for you. And not only that do we sign you up, but once we sign you up, if you need help, we help you. Not only that, but every year when plans change like they're about to, tomorrow's the first day of annual election period where you can make changes to either your Advantage plan or your Part D drug plan. We call, at least I can speak for me. I send a letter and I call them and I make sure that they're happy with what they have. And if there is something better, or sometimes like if your plan's being eliminated, like several companies and plans are being eliminated, we try to help you find the next best one. So That's my story. I'm sticking to it.
Well, I got to tell you something. Randy, and has nothing to do with you. I hear about all these insurance companies making millions of dollars.
Mhm.
And
Billions
as you
even.
know, yes, right. And as you know, I'm on Medicare. I love Medicare. But I went to the eye doctor yesterday. Now,
Mm.
2 years ago, I got my frames, I got my glasses, I got the exam. It was nothing out of pocket. So, with the same company, this is why you got to be very careful. Maybe the same company's not the best for you, but I went in to have my eyes examined, had to get new glasses, and it was about $160 out of pocket,
Not
which
bad.
I was shocked. Here they are making all this money. Now that's just one area. I don't know what areas are changing, but boy, I got to tell you, people really need to understand their policy.
Well, the other thing, Steve-O, is what part or what county you reside in has a huge impact on that. See, even here in a state like Tennessee, there's really three regions. So I'm in Middle Tennessee. I'm based out of Middle Tennessee, the Nashville market. And then there's, the West Tennessee, which is Memphis and Jackson. And then there's East Tennessee, which is like Knoxville, Chattanooga, all of that. Well, what's good here in middle may not be what's best for you in East or West. So
Right.
if you call me and you tell me what your situation is, I can kind of help you figure out, what's good if you have the best thing for you. And we don't charge any money. If you end up using us as your agent, the companies all pay us. And if it's Medicare Advantage, they all pay us the same. So we're not biased by anything other than what's best for you.
Yeah, I noticed that we got our first question of the day is, do you represent many companies? And
Yeah.
you've kind of answered that.
Yeah, I try. Sorry, I didn't mean to step on your question. Who it was, whoever they was.
No, it was our first question, and I want people to understand that you're not just tied to one company.
No. I think it's the best way to be, because if you say you
Yeah,
call into a specific company, all that they can tell you about is what they sell, and you think that they're going to be fair and balanced. No, they're going to be biased as hell. So when you're calling an independent agent, they should be down the middle, unbiased.
you know, Randy, I'm going to tell you something. We got a lot of letters, people wondering about these commercials they see on TV, and some of them sound too good to be true. First of all, these are national commercials,
Mhm.
and it doesn't mean what they're offering is the same thing like you're talking about in your area. I mean, it
Exactly.
changes. So that's confusing. And I'm telling you, what I've learned is get a good agent like Randy. Don't call up their 800. First of all, you might not even understand the people, which was one of the problems I had. I had no idea what their accent. It's so important to contact an agent like yourself.
Well, I couldn't agree with you more. The When you're looking at a TV commercial, you want to trust JJ, you want to trust Fonzie, you want to trust William Shatner or Joe Namath, but those guys don't even know what they're promoting. They're basically, it's what you said. So you live in Florida, right?
Right.
So there's counties like Miami-Dade County, for example. They have insanely good Medicare Advantage plans there. And so the rule is, if a plan's available anywhere in America, they could advertise it on a national level, as if it's available everywhere, right?
Right.
So what the whole game is, to get you to call their number, and then they're going to find out where you are, and they're like, well, we can't give you that one, but we can get
Right.
you this one. And those are the classic bait and switch is what we're talking about. Odds are they are not going to care about whether your doctors take it, if your prescription drugs are covered well. They'll do, if you're lucky, they'll make sure that your doctors and your drugs are at least covered. But they're not going to know how the plan actually works in the real world. When you call somebody local, even if you're not in Tennessee, if you call somebody local to where you live, they're going to give you hopefully what's good, what actually works. Because it's not just benefits on a page that you're looking at. It's not all what's in the summary of benefits, they call it. There's what's on paper and what actually works. And one thing I'll tell people is what actually works in the real world.
Randy, I got to tell people, and I don't know if it's this way in Tennessee or not, but when I signed up, I was looking at the plan that would cover my orthopedic surgeon, that they were part of the group because I really liked my orthopedic surgeon. And I signed up, and then I find out that even though they're on the list, they're really not on the list. There's like a group within inside of a group.
Oh, really?
And and they don't use my orthopedic surgeon. And that was very confusing. Is it like that in Tennessee?
Well, so here in Tennessee, there was a plan that was like that, but they stopped being like that. So there's no more like that anymore. However, if there's a wild situation like that, that's really that specific, that's the kind of thing I would be like, well, look, your primary care doctor and your specialist have to be in the same group. That's what you're talking about, right? Yeah. So that can happen in some areas of the country. It doesn't happen here in Tennessee anymore. But that's the kind of thing, if you're dealing with an independent broker or agent, they ought to be able to figure that out before you sign up. Because that's when you want to know, before you sign up. So does that answer the question there?
It does. It does. We had a question also. I always hear about, this is from Chris in Brentwood. I always hear about Medicare supplements and Medicare Advantage. Are they different? Is one better than the other?
So yes, they are different, to answer your question, Chris. One has original Medicare as primary, and then in the case of Medicare supplement or Medigap, it fills in the gaps of original Medicare. And that's more of a pay before you need it plan. So you're paying a premium for a Medicare supplement on the front end. Medicare Advantage is different in the sense that instead of original Medicare being primary, the company you pick is primary. So you told me in the past you have Humana. So say pick any Advantage plan, but in Steve's case, for Steve, Humana is primary, and Medicare pays Humana to cover all of Steve's Medicare benefits, A and B both, and D, and it combines them into one package called Medicare Advantage. And because it's a private insurance company, keep that in mind, HMO or PPO, that's why networks are important. When you're on original Medicare, basically if the doctor or provider takes original Medicare, they're going to take your supplement. No real network. You could go anywhere in the country. With Medicare Advantage, network's very important. It's usually HMO or PPO. So that's when you got to make sure doctors are covered in that situation. Does that make sense?
Yes. And Randy, I got to tell you, one of the biggest questions we get for your show, and this is the reason why we have a show like this, is people wanted to know what's the difference between Medicare and Medicaid.
Oh yeah, the end of the word, very different. No. So
yes.
Medicare care is at the end of the word. So that's your health care, and you can get Medicare one of two ways: by turning 65 or retiring from your job after 65, and then if you're on disability, for 2 years, then you can usually get Medicare A and B early if you're on disability for 2 years. Now, Medicaid aid, that's based on your financial status, and you can get that at any age. So if your income and assets are low enough, that's how you get Medicaid. Now, you can have both. You can have Medicare and Medicaid simultaneously. And if that's the case, these TV commercials we were talking about earlier, a lot of those commercials are aimed at people who have Medicare and Medicaid both. And when you have both of those, you can get special plans called with dual plans. And that's what gives you all these food cards and stuff like that. So like on those dual plans, when you have both of them, you can get like food cards, you can get a lot more dental, vision, and hearing. You typically don't have copays for anything medical. So if you have both, you have access to plans that people who only have one or the other don't.
Let's talk about dates, Randy. The open enrollment. When does that start?
Tomorrow. So that would be October 15th. And then it goes on until December 7th. And you can change as many times as you want/need to during that time period. So say you signed up for something on the 20th of October, and then you find out, oh, that's not the plan I want. So on November 17th, you pick another one. Well, the one you picked on November 17th, the last one you picked before December 7th, is the one that would be in place for the first of the year. And then there's also open enrollment. So say you pick a plan, Steve, and you find out your doctor doesn't take it, or something wild happens where you find out that that's not a really good plan after all. You can, if you're on Medicare Advantage, you can change one time from the beginning of the year, January 1st to March 31st. So if you pick a plan and you're not comfortable with it, you can change one time. Keep that in mind. And then also, if you're on Medicare with a supplement and you need to change your Part D drug plan, you can also change, but you can only change from October 15th to December 7th for the drug plan part, if it's a standalone Part D. Hopefully this isn't confusing you.
No. Well, listen, I went through it. And tell people what can happen to you if you miss the enrollment.
So are you talking about what happened to you specifically?
Yeah, what happened to me?
So if you're 65 and eligible for Medicare A and B, and you don't have creditable drug coverage, like through a job is usually how you would have that, or a spouse's job. If you don't have that and you don't activate A and B, then you get it later. If you get it later, they're going to penalize you like 10% of the premium, and it's permanent. So if you don't have creditable drug coverage and you're turning 65, make sure you activate A and B. And then once you have A and B, then you can either get a Medicare supplement without having to answer health questions to fill in the gaps of Medicare, and then you get a standalone drug plan, or you can get a Medicare Advantage plan. And here at Mr. Nice Guy Medicare Advisor, we do them both. We do all the either or. So you got to have one or the other. You can't have both. That's another thing I want to point out. So did I answer that?
Yeah.
Well enough?
What about pre-existing? Do they have to take you no matter what your medical?
So on Advantage, they have to take you no matter what. Okay. Any health condition, and up to and including end-stage renal disease on Advantage, they do. Now, if you're new to Medicare, if you're getting on Medicare A and B for the first time, you can get a Medicare supplement without any underwriting questions. They give you 3 months before your 65th or whenever it's starting, the month it starts, and then 3 months after, actually 6 months for supplement, 6 months after your A and B start to get a supplement without health questions. Now, either one of them would have to cover you for any pre-existing condition from the day it starts. So if you want to get another Medicare supplement after that, You can always change your Medicare supplement. Say your rates get high, you can always change your supplement, but you have to answer health questions and go through underwriting. And if you have a condition where they won't take you, then you'd have to go Advantage plan if you ever wanted to change. But if you're healthy enough, say your neighbor, their premium, they're 75 years old, perfectly healthy, and their premium's gotten really high, like $300 or something. Well, a guy like me, we could shop their plan and get them on a new company with the exact same insurance. And then they'll often pay a lot more for the exact same insurance plan. So if you're in that situation and you feel like you're a pretty healthy person, give me a call and I can see if I could save you money on your Medicare supplement.
Craig in Nashville wants to know, do I need to sign up for Medicare if I'm still working?
So if you're working at an employer and you have what's called creditable coverage, which most work insurance would be considered that, you do not have to activate or sign up for Medicare A and B. It's only if you don't. However, I will say this, Steve. If you have work insurance and you don't have a dependent, like a wife or a kid who's counting on the insurance, you don't have to support other people on it. You might want to compare what a Medicare plan would be to your work insurance, because a lot of people don't realize that 90% of the time, a Medicare plan is going to be cheaper and better insurance than most employer insurance. So if you don't have other people on there, like your wife and kids, it's always worth looking at. And the type of person I am, I'll look at both and I'll honestly tell them, you want to keep this, or I'd say, well, I think you could do better if you just went on Medicare and got this. I mean, and I don't charge any money to do that. I do that free of charge.
Here's a great question. Do I need a drug plan if I don't take any prescriptions?
So yes, you do. Because if you don't get a drug plan when you're supposed to, basically when you get on Medicare A and B, they give you 3 months to get on a drug plan, and you don't have creditable coverage, then they're going to penalize you. It's 1% of the annual premium or average premium. And it's something like 40 cents a month penalty. And I'm sure you paying that too, right?
Yes.
Yeah. How many months did you have without Part D?
I actually had to wait a whole year before I could get on a plan because I missed it.
So you have 12-month penalty.
Yeah.
Is it like $3 or $4 a year?
It's about 3.
Yeah. And it's permanent. So, and there are drug plans out there. So if you're on an original Medicare and a supplement and you just need a standalone drug plan, I call them a placeholder plan. There are ones as low as 0 premium in our state. So there's no reason not to have one, even if you don't take any drugs. But here's the other thing. Say you don't take any drugs right now. Well, if they prescribe you like a blood thinner, like an Eliquis, for example, that's an expensive drug. And if you don't have a drug plan, you're going to be paying 100% out of pocket. So just go ahead and sign up for the cheapest one. And even if you don't think you need one, just get it as a placeholder.
I know Pfizer and I forgot the other pharmaceutical company are going to be reducing their drugs by as 80, 90%. Will we see that in the cost?
Not this year. Most likely we won't this year, because they do these formularies that determine how much you pay.
Mm-hmm.
They do these formularies like a year, like 9 months in advance. So it may take a year for it to show up. Next year is when you would feel the impact of that, if that makes sense.
I got to tell you, you got a good show when all of a sudden you look at the clock and you got a minute left. You got a good show. Tell people how they can reach you, Randy.
Well, the best way to me, you can always call or text me at 615-578-5174. That is always the best and most efficient way to get a hold of me. And if you call and I don't answer, I will always call you back if you leave a message. So I look forward to hearing from you guys out there in Tennessee.
Randy, thank you so much. You're going to get real busy starting tomorrow.
Oh, I've been busy,
And
Steve-O, but yes, it gets crazy
and you'll
starting
be
tomorrow.
back with us next month. And if
Mhm.
you want to see the show again, you can go to YouTube, iHeart, or Spotify under Ask the Experts Tennessee. Randy, thanks again. We'll see you next month.
Thank you, guys. I appreciate you.
That's Randy Hall. Folks, I got to tell you, he is a great agent. Tomorrow starts the day. Give him a call. Don't wait too long like I did. Hey, that's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Experts show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.